Here is the question. Right, so if you have read and understood, considering it critical care scenario, kindly please tell me, how would you manage this patient now?
Okay, ma'am. So I will manage the patient according to the critical care surgical ill patient. So
Yes.
we have to check the airway breathing circulation. I will talk to the patient. If she is able to talk, that means the airway is patent. Then I have to check the breathing. If there is no sound, if he's breathing well, saturation is fine. Then I have to go for circulation. I have to check IV fluid is running or not. Then if it's not there, I have to open wide bore IV cannula and start IV fluid. So then we have to see disability and exposure as well.
How would
Then
you
I will check.
manage the pain of this patient according
Okay,
to the drug chart which has been
so I
given?
will check the drug chart as is prescribed only paracetamol and COX-2 inhibitor.
Yes.
Then I will try to manage the patient according to the step ladder pain management of NICE according to NICE guideline. So if as is a poor pain medication, then I have to go for a very strong, maybe opioids or maybe NSAID. So if NSAID is also not helping, then we can go for opioids.
What is WHO's pain ladder?
So we have to start with weak NSAID like paracetamol or maybe weak opioids. If it's not helping, then we can go for combination of weak NSAID and opioid like paracetamol and codeine. Then if it's still not helping, we can go for a strong NSAID like diclofenac, ibuprofen, COX-2 inhibitor. Then if it's also not helping, we can go for opioids, a strong one like pethidine, morphine. And then if it's still not helping, we can go for maybe epidural or patient control analgesia, PCA.
All right. What is patient-controlled analgesia?
So patient control analgesia is
some advantages of it?
Okay, so it's a analgesia which is mainly controlled by the patient. Is a one-way valve cannula. So patient has to inject himself, and that valve will control the amount of drug. So it will not, it cannot be given more drugs at a certain time. So the importance patient can inject himself, no need another help hand, and then he might uh, understand his pain threshold and
reduces nursing input and medication
reduces
errors.
nursing input and unnecessary medication as well.
And also it reduces internal safety mechanism to prevent opioid overdose. So, right, patient has been taking paracetamol and COX-2 inhibitor. How would you know if the medication, that pain medication that patient is taking is overdose or is given in the correct dose, required dose?
So we have to check the prescription chart. So we have to check how many times the medication was given, which time it was given, and which dose it was given.
Yes. It's in front of you, considering this is the chart which is mentioning, and patient after hemorrhoidectomy still complaining of pain. So which medication you'll introduce and in how much dose?
Okay, ma'am. So now from here, I will go for maybe medium potent opioids like tramadol.
All right. Please tell the dose as well. How frequent would you
Okay, so
take?
tramadol we can go for 100 milligram IM 3 times daily.
All right. So what can happen if you don't get to manage this patient's pain on time? What are the complications that you expect to see?
Okay, so if the patient is not maintained well analgesic, so patient might have tachycardia, patient might have respiratory distress, patient might have decrease or unable to mobilize.
So all the organs are being affected. So you can maybe
Yes.
classify like cardiovascular effects, could be increased
Okay, so
heart rate, increased
heart
blood
rate,
pressure, increased
chance of
myocardial
MI.
infarction, leading to MI, yes, and GIT, delayed gastric emptying, reduced bowel motility.
Yes, could be paralytic ileus.
Yeah.
Respiratory could be limited chest movement, could be leading to atelectasis, maybe pneumonia and respiratory
Okay.
depression.
Can you please tell me what is the pain pathway? Can you explain the pain pathway?
Okay, so that one is from that receptor.
Yes. So patient is
So
complaining about pain after hemorrhoidectomy, so nociceptors
okay,
from here.
so pain will be transmitted via some fibers. Like for fast pain, it will be A delta fiber, and for dull pain or slower pain, it will be C fiber. So from that fiber, the pain will travel through the lateral spinothalamic tract. Then it goes to the thalamus, and from thalamus, it will goes to the cerebral cortex, or primary sensory
Right.
motor cortex.
In the beginning, it will travel through the dorsal horn of the spinal cord. All right. Can you tell
Okay.
me what are the scoring systems that you are aware of?
Okay, so there are different scoring system. One is called verbal numerical system. The other one is a Ong-Becker pace.
No. Verbal rating scale is one, numerical rating scale is second, visual analog scale is third, and functional assessment. How would you use the functional assessment system of pain scoring? Can you give some example?
That one, maybe we can ask the patient, can you move your
Very
limb?
good.
Can you
Very
move
good.
yourself? Or do you
Uh,
need help?
can you name um, few stimuli which are released from the pain, from the site of damaged cells or from the pain site of pain?
I didn't get the question, ma'am.
From the site of pain, certain stimuli or certain structures are released. Certain stimuli are released. If you can name few, like bradykinin,
Okay,
histamine, and serotonin,
serotonin. Yes.
and prostaglandins, etc. All right. Okay, maybe one last question. Right. I wanted to ask you one. How would you manage paracetamol toxicity?
Okay, so we have to take a small history, how many tablet the patient took, and then we have to check the vitals. How is the vitals? Is it normal? And then if the patient came like early, we can go for maybe, okay, we have to start, of course, with the ABCD assessment, and then we have to check when the patient was taking. If he's taking within 30 to 60 minutes, we can give gastric lavage. If it's more than 1 hour to 2 hours, we can give activated charcoal, and then we can give antidote like N-acetylcysteine.
Okay. What's the role of activated charcoal? That is also the same.
Okay, I
It's like
didn't know.
given. Yeah.
Hmm.
So that was it. Okay, thank you.
Okay, ma'am.